Hello everyone, and welcome to this Trends Research Update. My name is Hannah Warren, Urology Registrar and on the editorial board of Trends in Urology and Men's Health. I'm delighted to be joined today by David Eldred-Evans and Ben Challacombe. David Eldred-Evans is the author of the PROSTAGRAM study that was conducted at Imperial College London and published in JAMA Oncology last month. He's going to give us an overview of his work, which was part funded by the Urology Foundation. We also have Ben Challacombe, who's a consultant urologist at Guy's and St Thomas's NHS Foundation Trust and specialist in the management of prostate cancer. He's going to help us put this work in perspective. So without further ado, David, do you mind telling us more about the PROSTAGRAM study and what we've learned from it?
Thank you very much for inviting me to talk about this. And PROSTAGRAM was a clinical trial which basically took MRI to the next step. We know that MRI in prostate cancer has truly transformed the way that we evaluate men with a suspicion of prostate cancer, and PROSTAGRAM was the first clinical trial to look at whether a fast MRI could be used as a screening test for all men in the community to look for prostate cancer. And we already use imaging to screen for mammograms, for breast cancer, and for AAAs in aneurysms. And this was the first time that we could see whether MRI or ultrasound could be used in an equivalent way in prostate cancer. And we invited 408 men without a history of prostate cancer screening, and they had a PSA test, a fast MRI, and an ultrasound technique. And if any test was positive or suspicious for prostate cancer, they had a biopsy. And essentially what we found was that PSA and MRI had a similar biopsy rate, but there was an initial signal that MRI may detect more clinically significant cancers than PSA. And we defined a new threshold for what we would call a screen positive MRI, which is a score of 4 rather than 3 as a screening test.
Super, thank you, David, for summarising your work. It really is a huge success, not just for British urology and British patients, but hopefully could go on to improve outcomes for men around the world with prostate cancer. Ben, are you able to perhaps tell us more about what PROSTAGRAM could mean in the future for men with prostate cancer?
Yes, well, thanks, Hannah, and particularly thanks, David, for this amazing study, and it's great that Tufts been involved in this funding. As a head of an MDT, a research group, and the like, looking at and managing men with prostate cancer, this is very exciting work, because really it shows that if we went out and screened a group of men, particularly those men with a family history or at higher risk due to their African and Caribbean background, that we may well be able to pick up prostate cancer that is significant, as in potentially lethal, at an early stage. And the PSA test has traditionally had really quite a bad rap, because it was not as specific as we would like, as in it picks up a lot of other signal, whereas this gives us a much clearer signal. So I think it opens up the path for a whole lot of other studies that are going to be able to really go out, and I see in 10 years' time, we may be calling men for their annual MRI scan, or every 5 years they have an MRI scan. So it could make a huge difference. And I think it's great work, David. Well done.
Okay, so in summary, PROSTAGRAM, a short MRI scan or fast MRI scan as a screening tool for detecting prostate cancer in men. What next steps do you think we need to see, David, before we see a national image-based prostate cancer screening program in the UK?
We're currently planning a larger study of around 20,000 men, re-evaluating MRI in a similar setting. Although the initial results show that MRI may detect more clinically significant cancer, the study was not powered to show that. So we need a larger study to confirm the initial signals.
And what do you see as the potential pitfalls for MRI-based screening, and how do these compare to our current system of prostate cancer detection?
So the main issue with MRI is always going to be around cost. It's currently £100 to have a PROSTAGRAM, compared to £4 for a PSA test. So we may need to look at combining those modalities into a screening pathway moving forward. So you take the good bits of PSA, maybe at a lower threshold, and combine with MRI to reduce the number of MRI scans you need to do.
Okay. I also wanted to just commend your group on your excellent effort of a conscious effort to increase the participation of Black and ethnic minority populations in this study, particularly as we know that Afro-Caribbean men have a higher risk of prostate cancer and more aggressive disease. And in your study, 32% of your study population was from this background. What strategies did you employ to overcome these typical barriers to recruitment in these populations?
So when we designed the study, we set up a dedicated recruitment strategy for our local Afro-Caribbean population. We were fortunate that we're recruiting in an area of West London with a high percentage of Black men. And it was very much a case of going out into the local community and talking to community leaders, actually using social media and WhatsApp to send the message around. And once we got a few key leaders on board, the recruitment actually just took off. And as you rightly point out, previous screening studies have had very low recruitment rates in this population, which makes it hard to draw conclusions in this subgroup that's very high risk of prostate cancer.
That's a really excellent initiative and great to hear. Ben, do you have any further questions for David on PROSTAGRAM?
Yeah, I think that relevance that you discussed there with the Afro-Caribbean community is hugely important. Over 50% of the men that I carry out radical prostatectomy on in our hospital are of Afro-Caribbean background, and almost no previous studies anywhere in the world in prostate cancer have had that kind of representation. So that means that it is actually relevant research for the totality of British men with prostate cancer, which I think can't be emphasized enough. And also, I think, David, that this work will allow us, if we're getting MRI tests down to £100, that is an achievable and affordable test now, whereas previously 5-10 years ago we were talking £500 to £1,000. We now have a chance with a stratified testing program to actually bring this to the most at-risk groups at an early enough age to really make a difference to outcomes. So I think it's going to be the start of a number of projects, but this is you may have unlocked the door to a whole avenue of research that will help future prostate cancer survivors.
And this work has been widely quoted in mainstream media. Ben, are you starting to see patients coming through clutching their newspaper clippings about PROSTAGRAM?
Well, as you know, a lot of men do come to the clinic with those newspaper clippings. So we have had a few men obviously are asking their GPs, can I have this test? And a GP at the moment doesn't have access to order a multiparametric MRI, but they certainly are getting more aware of the fact that they can send men in with the age-specific PSA level. And then, of course, as part of our workup, we and most centres in England now do an MRI as part of the assessment. And I think that that is key in getting the message out there to primary care and to at-risk men to come and get tested. And the NHS is there at the moment to do the relevant diagnostics and treatment, and I hope will always be so.
Super. Thank you both for joining me.